The question on whether certain therapies I do may be of benefit to you is a hard question to answer with the information that I have right now. And that's predominantly because, to me, the things that I'm hearing so far is that what's causing the symptoms in your leg may not be actually coming from your back. And the reason I say that is because epidurals, for the most part, are pretty powerful things. And so unless there is complete crushing of the nerve, which if we had that in the back, we would also generally see severe motor weakness, and you would generally have pretty intense symptoms that go down the whole leg, not just a small portion of the leg. In those types of situations, the epidurals may not be effective enough because the physical compression on the nerve root may be so severe that no amount of steroid is really going to be able to have an impact on that. That's obviously one possibility. Now, from what you've told me about surgery, my guess is that when they did the fusion, they also you had a microdiscectomy where they took out the part of the bulging or the herniated disc that was compressing on the nerve root, because that's generally, what they do in those types of situations. And so, you would hope that that is effective. And so the fact that you're still having these symptoms and epidurals beforehand didn't maybe seem to help overly that much, surgery didn't help, epidurals afterwards did zero for it, makes me think that maybe the problem is not in your back. It might be somewhere else along the nerve path. So the nerve that goes down the kind of outside of the leg and then onto the top of the foot are branches of the peroneal nerve. And so with that, we can have compression or entrapment or friction injuries at other places that are not in the back, and you can get those same symptoms. And then unfortunately, this is a hypothetical, but let's say that is what's going on, and then somebody takes an MRI of your back because you do have a little bit of back pain, and maybe they're related, maybe they're not. And now all of a sudden they're linking the two things together. This is all hypothetical because I've not done a physical assessment on you, because that's what I would really need, because there are different tests and things that I can do to try and determine, is this nerve issue more peripheral? Meaning, is this a nerve issue that's starting around the knee and that's why you're feeling it below the knee? Or is this nerve issue in the low back and just the current treatments that you have tried for the low back have not been overly successful? And then if that's the case, taking the next step and trying to figure out why that's the case, and then looking to apply our approaches with the orthobiologic injections, maybe a nerve hydrodissection, or something that might be a little more healing than the steroid injections that might have a little more benefit.